Hi everyone, I'm Dr. Divya Shanthi and welcome to NEET PG Core Revision series. These series are structured, focused and exam oriented so as to help you recall faster and more confidently in your exams. In today's session, we are going to break down the anatomy of parotid gland into clear, high-yielding, exam-focused concepts. So let's get started. Now the parotid gland, para-otid. Okay, so parotid is derived from two words, para and otic, means around the ear. So this parotid gland is located in the parotid region around the ear. Okay, so it is the largest salivary gland. Among the major salivary gland, it is the largest salivary gland. Okay, it is the largest salivary gland among the three major salivary glands. So we have the sublingual, submandibular and the parotid gland. So parotid is the largest salivary gland and it is inverted pyramidal shape. So this parotid gland is present in the parotid region and parotid region is around the ear. So this region is bounded anteriorly by the anterior border of the masseter muscle. Okay. So it is bounded anteriorly by the masseter muscle, posteriorly by the mastoid process, superiorly by the zygomatic arch, and inferiorly by a line, imaginary line drawn from the angle of the mandible up to the mastoid process. So this imaginary line forms the lower boundary. So this is the boundaries of the parotid region. And the main content, the principal contents in this region is the parotid gland. That's why it is known as the parotid region. Another structure which we see will be the facial nerve. So these two structures, they form the main principal structures in this parotid region. Now the parotid gland in this parotid region is located in a pyramidal fossa. Okay, so this fossa we call it as the retromandibular fossa or the parotid bed. It's also called as the parotid bed. So what are the boundaries of this parotid bed? So when we say the boundaries, anteriorly here it is bounded by the posterior border of the ramus of mandible. Okay, so anteriorly it is bounded by the posterior border of the ramus of the mandible, and posteriorly, so here we have the ramus of the mandible and behind we have the mastoid process. Okay, posteriorly the mastoid process, and superiorly here when we see we have the external acoustic meatus and the posterior part of the TM joint. Okay, external acoustic meatus as well as the posterior part of temporomandibular joint is present here. And medially when we see there is the styloid process. Okay, so these are the boundaries of the parotid bed, and here the parotid bed is formed by the muscles which are attached to these bony landmarks. So to the ramus of the mandible, we have the masseter laterally and the medial, okay, medial pterygoid medially. And to the mastoid process, we'll have the sternocleidomastoid muscle laterally and the posterior belly of digastric medially. And to the styloid process, we have the three muscles there, the stylohyoid, the styloglossus and the stylopharyngeus. So these muscles, right, form the parotid bed, providing a soft bed to the parotid gland. So the parotid gland now, as I said earlier, it is the largest of the three major salivary glands. So it weighs about 25 grams and it is, if you see, it is inverted pyramidal in shape. Inverted pyramidal in shape with the apex will be directed downwards. So it is mainly lobulated. Okay, it is entirely made up of the serous alveoli, highly lobulated and yellowish brown in color. and weighing about 25 grams. So now we will see what are the structures covering the parotid gland and forming the capsule of the parotid gland. Now this parotid gland will have two capsules, the true capsule and the false capsule. Okay. So when we see what is this true capsule? So true capsule is formed by the condensation of the fibrous stroma of the parotid gland itself. Okay, so the fibrous stroma itself, it will condense and forms the true capsule. And this true capsule, since it is formed by the stroma of the gland itself, it is very adherent to the gland. So that is true capsule. Then we have the outside, the false capsule or the parotid sheath. Okay, and this false capsule is formed by the investing layer of the deep cervical fascia. So it is formed by the investing layer of deep cervical fascia. Now this investing layer of deep cervical fascia, now it splits. Okay, it splits to enclose the parotid gland. So it will have two lamina. We will have the superficial lamina and the deep lamina. Now the superficial lamina of this parotid fascia, it is very thick. Okay, the parotid capsule or the parotid sheath, it is very thick. This is the superficial lamina and it is very thick. So this will blend, okay, after it encloses the parotid gland, it blends with the epimysium of the masseter muscle and forms the parotidomesenteric fascia. Okay, it forms the parotidomesenteric fascia. And it is attached about the zygomatic arch. So here it will be attached about the zygomatic arch. So that is about the superficial lamina. The deep lamina compared to the superficial lamina, it is thin. Okay, it is thin and it will be attached to the tympanic plate here. Tympanic plate and to the styloid process. So here it will thicken, okay, it will thicken to form the stylomandibular ligament. So it will thicken and forms the stylomandibular ligament. And this stylomandibular ligament separates the parotid gland from the submandibular gland. So that is about the false capsule. Okay, false capsule, also called as the parotid sheath or the parotid capsule. So this is a cross section where we can see the coverings of the parotid gland having the superficial lamina. So this will be the superficial lamina and this is the deep lamina. Here we will have the stylomandibular ligament formed by the deep lamina. So that is about the capsule. Next, moving on to the presenting parts. Okay, so next moving on to the presenting parts of the parotid gland. Now the parotid gland is a inverted pyramidal shaped gland. Okay, so it will have an apex. So when we see it has an apex here, it will have a base. Okay, which is also called as the superior surface. Okay, so this is also base as well as superior surface. Then it will have three borders. Okay, there are three borders anterior. We have the anterior border, the posterior border as well as the medial border. And this is the transverse section where we can see this is the medial border, anterior and posterior border. So here certain structures are in relation, the nerves and blood vessels are in relation to these borders and surfaces. So we need to understand the anatomy of the parotid gland and the structures in relation to the surfaces and borders of the parotid gland. So now when we see its position in the parotid region, so we can see the parotid gland as an inverted pyramidal shape with the apex directed downward. So this will be the apex. So the base will be around the ear. Okay, so base will be around the ear. So base is also, we call it as the superior surface. So this will be the anterior border, and this will be the posterior border, and the medial border will be towards the inside. So when we take a section and see, so this is how we will see here parotid gland. So this will be the anterior border here. This is the posterior border. Here we will have the medial border. So between the anterior and the medial border, we will see the anteromedial surface. And between the posterior border and medial border, here we have the posteromedial surface. And this will be the superficial or the lateral surface. So thus the parotid gland will have 4 surfaces: lateral, anteromedial, posteromedial, as well as the base, which is also called as the superior surface. 3 borders: anterior, posterior and medial, okay, and an apex and the base. So these are the presenting parts. So next we'll move on to the relations of these parts. So first coming to the apex. So the apex overlies the posterior belly of the digastric. So it will be directed downwards and overlies the posterior belly of digastric here. So this is the apex of the parotid gland. So at the apex we will see one nerve, that is the cervical branch of facial nerve. Cervical branch of facial nerve and the anterior and posterior divisions of retromandibular vein. Retromandibular vein. So these structures will be emerging from the apex. Then we see the base or the superior surface around the ear here, around the external acoustic meatus. So it is related to that. And here we will see 3 structures, that is the auriculotemporal nerve, as well as the superficial temporal vessels. Okay, that is from the base. Then coming to the surfaces. So first is the lateral surface or the superficial surface. So superficial surface here, that is the largest of the 4 surfaces, and it is related from outside to inside. When we see, we have the skin. There beneath the skin, there will be superficial fascia. Here, so in the superficial fascia, we will see the platysma muscle also, and the anterior branch of the great auricular nerve is also seen there, and few lymph nodes are also seen. And then we have the parotid fascia, that is the investing layer, deep fascia, which we see, okay, which is covering the parotid gland as the false capsule. So we see the parotid fascia there. And deeper to that, there will be the lymph nodes. Okay, so these are the deep parotid lymph nodes. So these structures, they form the super relations of the lateral surface of the lateral or superficial surface of the parotid gland. Next, the anteromedial surface. So anteromedial surface is between the anterior border as well as the medial border. So now here when we see, okay, between this, so it is not like a very regular border, okay, so it's slightly irregular there, and it is related to the posterior border of the ramus of the mandible, okay, posterior border of the ramus of the mandible, and on either side there are 2 muscles, the masseter on the lateral side, and on the medial side we have the medial pterygoid, okay. So these muscles, the masseter as well as the medial pterygoid, they form the relations. In addition to that, we will also see the lateral aspect of TM joint, temporomandibular joint. So these are the relations of the anteromedial surface. Next, coming to the posteromedial surface. So where is the posteromedial surface? Between the medial border and the posterior border. So here, what are the structures in relation to this? So here if we see the mastoid process, mastoid process with the two muscles, the sternocleidomastoid muscle and the posterior belly of digastric. Okay, posterior belly of digastric. Then we will see the styloid process. Okay, this is the styloid process and the three muscles attached to it. Okay, with the three muscles, that is the stylohyoid. Posteriorly, then anteriorly there will be the styloglossus, and medially there will be stylopharyngeus. So these three muscles are around the surfaces of the styloid process, and we will see that in relation to the posteromedial surface. And we will see also the internal carotid artery as well as the internal jugular vein, and the last four cranial nerves, that is the 9th, 10th, this is the 12th and 11th. Okay, so 9th, 10th, 11th and 12th cranial nerves. So all of these, they form the relations of the posteromedial surface. Next, we will see the structures emerging from different borders. So, from the anterior and the posterior, we saw the structures at the apex and at the base. So, now we will see along the anterior border and posterior border. So, now when we see the anterior border here, we have the branches of the facial nerve, that is temporal branch. Then we will see the transverse facial artery. Then we see the zygomatic branch. Then upper buccal. After that we see the accessory parotid gland and the parotid duct. Then lower buccal. Then we see the marginal mandibular. Okay, so these branches we see along the anterior border of the parotid gland. Then posterior border here when we see, okay, so posterior border will be separating the lateral surface of the lateral surface or superficial surface of parotid gland from the posteromedial surface. So this border here we see, so along the posterior border we will see the posterior auricular nerve and vessels. Okay, so that is the posterior auricular branch of facial nerve as well as the posterior auricular vessels, artery and vein. So these structures we see along the posterior border. Next, at the medial border, okay, so the medial border is directed medially, so which will be separating the anteromedial surface from the posteromedial surface. And this medial border here, okay, so this is the medial border and it is related to the lateral wall of the pharynx. So it will be related to the lateral wall of pharynx. So these are the structures in relation here. And also for here we have to remember that the facial nerve, okay, so facial nerve, once it emerges from the stylomastoid foramen, okay, after completing its intracranial course, it will come out for its extracranial course through the stylomastoid foramen. So once it emerges from there, it will run forwards and it will pierce the near the posterior border and run through the substance of the parotid gland and emerges from the anterior border where it branches out and emerges there. Okay, so that is the course of the facial nerve there which we see within the parotid gland. Now coming to structures which passes through the parotid gland. Okay, so we saw the structures which are emerging from the different borders and structures in relation to the surfaces. Now we shall see the structures which pass through the parotid gland. So coming to the structures passing through the parotid gland from superficial to deep. Okay, first it will be the facial nerve. So facial nerve, as I said a little earlier, that it emerges from the stylomastoid foramen and then pierces through the posterior border where it enters the substance of the parotid gland. So here within the parotid gland, it will divide into two trunks, that is the temporofacial and cervicofacial. Okay, it divides into temporofacial and cervicofacial. And 𝗕𝗵𝗄𝗆facial nerve, it will give two branches, temporal and zygomatic. The cervicofacial will give upper buccal, the lower buccal, the marginal mandibular, and the cervical. So these are the branches of the facial nerve which emerge through the anterior border, as well as the cervical is emerging from the apex, near the apex. And that gives appearance of a goose feet, okay, so which we call it as the pes anserinus. So that is the basically nothing but the how the facial nerves emerge from the anterior border of the parotid gland. So here the parotid gland, when the facial nerve passes right through the substance of the parotid gland, it is divided into two lobes, okay. So one is a larger lobe which is the superficial. This is the superficial, and this will be the deep lobe. So here when we see, this will be the deep part, deep lobe, okay, and so this portion here is the isthmus, so where the facial nerve will be passing. So this when we take a section and see, right, so it looks like a head-shaped, the gland will appear like a head-shaped with the larger superficial part and a smaller deep part with the isthmus in between. Now this plane, okay, this plane between the superficial and the deep lobes in where the facial nerve, okay, so this plane here where the facial nerve is branching out, right. So this we call it as the 𝗪𝗃 fasciovenous plane, okay, 𝗪𝗃 fasciovenous plane. So this helps the surgeons to remove the parotid gland without affecting the nerve, okay, without damaging the nerve. The next structure which we see, okay, passing through the parotid gland. Now we saw the facial nerve passing transversely, right, like horizontally it runs, whereas there are two more structures passing through the parotid gland which runs vertically. So first is the vein. So after the facial nerve, we see the vein. So which vein is that? It is the retromandibular vein. So this formation of the retromandibular vein happens within the parotid gland. So it is formed by two veins. One is the maxillary as well and the superficial temporal vein. So these two veins join together to form the retromandibular vein. So the retromandibular vein, after the formation within the parotid gland, it divides within the parotid gland, it divides into anterior and posterior divisions, and these divisions emerge from the apex of the parotid gland. So the anterior division here will join the facial vein and forms the common facial vein. The posterior division will join the posterior auricular vein and forms the external jugular vein. Okay, so that is about the retromandibular vein, which forms and again divides into its divisions within the parotid gland. So the deepest structure which we will see will be the external carotid artery, okay, which will enter the gland through its posteromedial surface there, and then it will divide into its terminal branches. So we will see the maxillary here. So this is the maxillary artery and this is the superficial temporal artery. It will also give the transverse facial, okay. So the transverse facial artery, which is a branch from the superficial temporal artery, will be emerging from the anterior border. So that is about the external carotid. So three structures pass from superficial to deep. We will see the facial nerve, the retromandibular vein and the external carotid artery passing through the gland. So next is the parotid duct. The parotid duct is also called the Stensel's duct. So this parotid gland is about 5 centimeters in length. It is about 5 centimeters length and we see it emerging from the anterior border of the parotid gland. So when we see the course of the parotid gland, okay, so after emerging from the anterior border of the parotid gland, it will run forwards, okay, it runs forwards across the masseter muscle. So this is the masseter muscle, so it will run across the masseter muscle and then it will turn 90 degree, okay. So it is the first bend. So the first bend is here, so it turns 90 degree. So pierces the buccal pad of fat, then pierces the bucopharyngeal fascia. So this is the bucopharyngeal fascia. Then the buccinator muscle. Then after piercing the buccinator, again it will turn, okay, again it will turn, that is it will run forwards, that is second bend, okay, second 90 degree bend. For about 1 centimeters it runs forwards between the buccal mucosa here. So this is the buccal mucosa. So it will run forward between the buccal mucosa and the buccinator muscle and then it will turn for one last time, that is the third bend here. And then it opens, okay, it pierces that is through the buccal mucosa, it opens into the vestibule of the oral cavity opposite the crown of the upper second molar tooth. So here it opens opposite the crown of the upper second molar tooth. So that is the course of the parotid duct. So why does this parotid duct, instead of going just straight and opening opposite the crown of the second molar, why does it have to take a very tortuous course? Why it has to bend one bend and then second and third? Why should it do? So why it needs to be tortuous? Basically because to prevent the inflation. So when will the inflation of the duct can happen? To prevent basically the inflation of the duct. So when can the duct get inflated? So when we blow, okay, so when the excessive blowing of the mouth, like as in the trumpet blowing, okay, so in those cases what can happen is the duct can get inflated. So to prevent that, the duct has a very tortuous course. So coming to the nerve supply of the gland. So the parotid gland is supplied by the parasympathetic, the sympathetic and the sensory fibers, okay, sensory. So it has all the three, the parasympathetic, sympathetic and sensory. So the parasympathetic is mainly secretomotor, the sympathetic is vasomotor, okay, and parasympathetic stimulation produces thin watery secretions, whereas the sympathetic will produce thick secretion. And the sensory fibers basically supplied by the auriculotemporal nerve and the great auricular nerve, okay, so they will supply the skin over that region as well as the sweat glands. So when we see here now, the parasympathetic fibers, they begin from the inferior, that is the preganglionic fibers, begin from the inferior salivatory nucleus. So once they begin, they pass through the 9th cranial nerve, that is the glossopharyngeal nerve. Now the glossopharyngeal nerve will give a branch. Which branch? The tympanic branch. So this tympanic branch will form the tympanic plexus in the middle ear, okay, on the promontory it forms the tympanic plexus, and from this tympanic plexus begins the lesser petrosal nerve. Lesser petrosal nerve, okay. So this lesser petrosal nerve will relay in the otic ganglion. So this is the otic ganglion and it will relay in the otic ganglion. So from the otic ganglion, the postganglionic fibers will begin and through the auriculotemporal nerve will supply the parotid gland. Then coming to the sympathetic fibers. Now sympathetic fibers is derived from the sympathetic plexus around the external carotid artery. Okay, so they are already the postganglionic fibers. So the preganglionic fibers will be coming from the T1, from the lateral horn of the T1. Okay, so lateral horn of T1, we will have the preganglionic fibers. So they come to the superior cervical ganglion, and from there the postganglionic fibers which begin form a sympathetic plexus around the external carotid artery. and they pass through the otic ganglion without any relay because they are already post-ganglionic fibers, and that is supplies the vessels there. Okay, so it is vasomotor mainly to the gland. And then we have the sensory supply, which is derived by the auriculotemporal nerve. Sensory will be by the auriculotemporal nerve and great auricular nerve. Okay, C2 and C3. So C2 fibers are mainly sensory to the parotid fascia. So that is about the nerve supply. So the lymphatics from the parotid gland, they drain into the superficial and deep parotid lymph nodes. Okay, they drain into superficial and deep parotid lymph nodes, and this will later drain into the deep cervical group of lymph nodes. Okay, so here we see the superficial and the deep parotid lymph nodes, and they will be draining into the deep cervical. Okay, so here, and these will be in this region. So that is about the lymphatic drainage. This parotid gland, as we saw in the section and all, it is a little irregular, right? And lobulations, they extend. Okay, the process as processes, the gland will extend to different surrounding regions there. So those we call them as the accessory process of parotid. So those we call them as the accessory processes of parotid gland. So among this, we have the facial process. Okay, so this facial process is a small triangular process which will extend forwards anteriorly along the parotid duct. Then we have the accessory parotid gland. Accessory parotid gland. So this accessory parotid gland is basically the detached part of this facial process which we see. Okay, so it is situated between the zygomatic arch and the parotid duct. So it will be located. That is the accessory. That is why we are calling it as accessory parotid gland, because it's a detached part and itself stays separately there between the zygomatic arch and parotid duct. Then we have the pterygoid process. So pterygoid process here extends forward from the deep part of the gland between the mandibular ramus as well as the medial pterygoid muscle. Okay, so between the ramus of the mandible as well as the medial pterygoid muscle. So that is why it is called as the pterygoid process. So from the deeper part, this will be the extension. And then we have the glenoid process. So the glenoid process we will see in this region. Okay, so here this process, it passes upwards. So here between the external meatus and the capsule of the temporomandibular joint. Okay, so this will be the glenoid process. Here passing between the external acoustic meatus and the capsule of the temporomandibular joint. So we have the pre and post styloid process. So the styloid process is lodges in a groove. So the portion of this parotid process which lies in front of the styloid process, we call it as the pre-styloid process, and that which lies behind, we call it as the post-styloid process. So the pre-styloid process is related to the internal carotid artery there, whereas the post-styloid process is related to the internal jugular vein. So that is about the accessory process of parotid gland. So coming to the applied aspects or clinical aspects of the parotid gland, one of the common infections we see in relation to parotid gland is the mumps. It is also called as the viral parotitis. So it is a contagious disease which is caused by the specific mumps virus known as paramyxovirus. So this swelling caused due to, secondary due to this infection is very painful. Now why is the swelling very painful? Because the fascia is unyielding there. Okay, and so the parotid gland has no space to swell. So it has to swell within the, unyielding parotid fascia, because parotid fascia there, is formed by the dense connective tissue, and dense connective tissue doesn't have any, expanding property. It doesn't have that elasticity to expand because it is made up of collagen fibers, right? So there will no any space to expand, and that is why it will be very painful. And these swellings, they do not suppurate, means they do not form an abscess there, right? And sometimes in adults, usually we see it below the age of 15 years, and if we see it in adults, it is usually associated with epididymoorchitis as well as euphoritis, okay, and pancreatitis. Euphoritis in female, epididymoorchitis in males, along with pancreatitis is seen with this condition. Then there is parotid abscess secondary to bacterial infection, that is bacterial parotitis. So it can be acute, chronic or a recurrent condition. So this is mainly due to poor oral hygiene. So infection can spread to the duct, okay. So retrograde infection happens. So from the oral cavity, the infection can spread to the parotid gland through the duct. So since this is a bacterial infection, the suppuration is common, that is abscess formation will happen. And this abscess is drained by Hilton's method. So wherever it is pointing, okay, so there we just make a incision, horizontal incision, and drain the pus so as to avoid any injury to the nerves. And one more thing is this parotid abscess, right? It can spread into the parapharyngeal spaces. It can spread to the parapharyngeal space, or it can burst into the cheek or into the external auditory meatus, okay. So it can spread to these regions. Next, there is an important condition known as the Fries syndrome. It is also known as the auriculotemporal nerve syndrome. Now, sometimes penetrating wounds of the parotid gland, okay, can injure the auriculotemporal nerve as well as the great auricular nerve. So now, because of the damage of this auriculotemporal nerve and the great auricular nerve from these penetrating injuries, it can result in, during the healing process, it can result in Fries syndrome. So now how does this happen? Now we know that auriculotemporal nerve contains what fibers? It contains the parasympathetic fibers, right? And these parasympathetic fibers are secretomotor fibers. And through this auriculotemporal nerve itself, we also have the sympathetic fibers as well as the sensory fibers supplying the gland. And now we have another sensory nerve, that is the great auricular nerve, which is also supplying the gland, the parotid fascia. That region, the supply is by the great auricular nerve, and the skin over the angle of the mandible is also supplied by the great auricular nerve, right? So now when there is an injury and the nerves are healing, okay? Yeah, so this great auricular nerve, in addition to the skin it supplies, it also supplies the sweat glands. Now during the healing process, when the nerves are cut and during the regeneration process, what will happen? The secretomotor fibers of the auriculotemporal nerve, they grow into the endoneural sheath, okay? They grow into the endoneural sheath of the fibers, that is the sensory fibers, giving the cutaneous supply, okay? So basically as well as supplying the blood vessels. So because of this, whenever there is a stimulation for salivation, like while we are chewing the food or the thought of food, okay, or the smell of food, it can result in cutaneous hypersensitivity. It can result in cutaneous hypersensitivity, and that causes, okay, hyperesthesia there, hyperesthesia, sweating, warmth and redness of the face, okay. So we see these things. So whenever the patient is chewing the food, there is redness over that side, wherever the affected side, as well as beads of sweat will be seen there in that region. So that is known as the Fries syndrome, and this can also happen if there is injury and when the patient shaves. In male people, when they shave, right, so that time also this sweating and redness can occur. Next, there is mixed parotid tumor. So, mixed parotid tumor is a slow growing tumor, slow growing benign tumor. Okay, it's very rarely it becomes malignant. Only if it's a very long standing chronic, it can become malignant. But it is a benign tumor. We call it mixed parotid because of the mixed histogenesis. The other name for it is also pleomorphic adenoma. Okay. So, this tumor is painless. Okay, it doesn't cause any pain, just a slow growing swelling you can see, and that is because it doesn't involve the facial nerve region. Then there is this condition sialolithiasis. So, sialolithiasis is basically the calculi, salivary calculi, which we see within the gland or within the duct. We call it as the sialolithiasis. So, usually this condition is more common in the submandibular gland, okay, and the duct, because there the secretions are thick, little highly viscous, and the duct is directed against gravity. Okay, so because of which there may be stagnation, and if it is infected and all, it can lead to calculi formation also. But in parotid gland as such, it is less common. Okay. So, now let's solve some of the image-based MCQs. Identify the correct superficial to deep arrangement of structures within the parotid gland. So, within the parotid gland from superficial to deep, we have the nerve, vein and the artery. So, facial nerve, retromandibular vein and external carotid artery. So, answer B is the right choice. The parotid duct pierces which muscle before opening into the oral cavity? Which muscle did it pierce? It pierces buccinator. Masseter, it just runs across masseter but does not pierce it. Okay, so it pierces the buccinator muscle. Injury to the labeled nerve. So, which is the nerve within the gland? Facial nerve. Okay, this most likely results in the facial muscle, that is known as the Bell's palsy. Bell's palsy is the lower motor neuron lesion of the facial nerve. The secretomotor supply to the parotid gland is via the glossopharyngeal nerve to the otic. So, from the glossopharyngeal we have the preganglionic fibers, and then we have the postganglionic from the otic ganglion. Which of the following structures forms part of the parotid bed? So, here there is a little mistake in the question. So, which of the following structures do not form part of the parotid bed? Okay, so the answer here D, that is the buccinator, because all the other three muscles forms part of the parotid bed. So, we saw that the ramus and the two muscles around it, that is masseter and the medial pterygoid, the mastoid process and the two muscles there, that is the sternocleidomastoid as well as the posterior belly of digastric, and the styloid process and the three muscles around it, stylohyoid, stylopharyngeus and styloglossus. Okay, all of them form the part of the parotid bed. So, that is why all A, B, C are forming the parotid bed except for the buccinator. So, that's a wrap on today's session on parotid gland. So, stay consistent with this series as they bring you one step closer to your NEET PG dreams. So, stay focused, stay consistent and trust in your preparation. I'll see you in the next session.